my chair is being used for something that's more profitable now, whether it be a crown or an implant or a bridge or the next clear aligner case to get started and move along. So it allows a higher volume of usage, and it allows more profitability for that chair to be used for something else.
Hello, everyone, and welcome to the latest episode of the Raving Patients podcast. As you know, I'm your host, Dr. Len Tao, and today may look a little different. We've got two guests today, but we're going to be talking about something that may be a little bit different for some people. We're going to talk about a do-it-yourself aligner company, a little bit different. Many of you are aware of Invisalign, and many of you are aware of Smile Direct Club, and this is something a little bit different. And I'm excited to have the co-founder of one of the companies, as well as a practicing dentist who was just brought on to the company, someone that I know for a long time. We've worked together in a couple different instances, and we're excited to talk about this company that some have heard of, some may not have heard of. But I wanted to introduce the company to my audience because after speaking with them, I felt it was important to inform you about things we may not be aware of. So welcome to the Raving Patient podcast, Nick Greenfield and Ben Miraglia. Guys, thanks for joining me today. I appreciate it.
Thanks for having us.
Yeah, thank you, Len. Thanks for having us.
So let's talk about Candid. The future of clear aligners. Let's start with Nick. Nick, why don't you let the listeners and viewers know a little bit about you, a little bit know about Candid, the company, what you are, what you do, and then we'll pass the baton to Ben, and Ben can introduce himself, talk about what he does for you guys and how he's involved.
Sounds great. And thanks again for having me. I'm really excited to be here and talk about really, as you said, the future of clear aligners and demystifying some of the perceptions, misperceptions, and ideas around what Candid and specifically also what CandidPro can bring to the table. I started my career in startups entirely. I've worked every day of my entire career in the startup world, starting first at a company called Zimride, where we launched Lyft out of Zimride. And I was really one of the first few people working on that business and helped launch it all around the country. And now obviously get to watch as they've launched that and turned it into a publicly traded company. And have worked at a couple other startups. But in 2017, when I started Candid, we started the company with a very clear mission of creating affordability, accessibility, driven through high quality patient care and patient outcomes. And, as you mentioned at the top, I would definitely not consider Candid a do-it-yourself. I would consider Candid a company that's highly focused on working with doctors to provide high-quality telehealth-driven care. But we also have a new model at Candid, and that model is geared around starting cases inside of a dental practice. And Dr. Miraglia, who's here with us today, is really helping lead the charge for us on identifying, working with, and bringing on dentists who want to increase revenue in their practice with one of the most profitable per chair hour procedures you can provide in clear aligners. And we think CandidPro really is different and can help doctors get that going, especially those who haven't had a ton of experience in clear aligners. So I'll turn it over to Ben to give a little bit more on his background.
Yeah, thank you, Nick. Len, thanks for having us. So excited to be here and share with you, the new chapter of my life. I am a general dentist. I've been practicing for 29 years now. Probably 17 or 18 of those years are in, with clear aligner service to our patients. And more recently now, it's been, involved with Candid. And so several things drew me to Candid. Some of it was kind of a progression of how I was kind of moving through my clear aligner evolution, we'll call it. And the short story there is that I'm using less and less IPR as the years are going by, and not only involved with patient care, but also teaching it. And so anyone who knows me in the clear aligner world knows I've taught in the little to no aligner category, a little to no IPR category. So trying to use less or no IPR has always been a focus. And with teaching being about 15 of those years that I've been involved, that's always been a goal. So working my way out of the IPR was a priority. As far as the attachments go, the last probably 5 to 10 years, I've been working on using less attachments on my own. And so as I've gotten to the point where I'm using little to no attachments and have treated a fair amount of cases without attachments, the thing that kind of, drew me to Candid immediately was that it's a no IPR and no attachment type of treatment. And so right away I was interested because I was kind of heading in that direction. Then having met the good folks at Candid and then having, of course, looked into and done a little bit of my own digging, I feel really comfortable that there's an incredible opportunity, as Nick stated, to have really good access, really good monitoring, and really good outcome and treatment and care in a manner that does not incorporate IPR or attachment. So I'm really excited about this new chapter in my clear aligner world.
So not to bring up old news. So, we met, it's got to be 2000 and maybe 2012. I think we met at one of the, I think it was the Invisalign forums. I think originally we shared the stage with David Galler and I don't know who else was speaking there, but we go way back. So you had a ton of experience with Invisalign for many, 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 many years. You were one of their key clinicians. You taught their certification class. I mean, you've done everything for Invisalign, and you now have decided to make a change, and you kind of, said bye-bye to Invisalign and joined Candid. I want to make sure people understand that.
Oh, yeah. In fact, I believe my resignation was on June 4th. I did have to resign from Alliance faculty in order to be able to explore other opportunities. And so now I am basically with Candid and, considered either faculty or key opinion leader. I'll be an educator for them. And so I'm working with them in pretty much every direction you can as a clear aligner company would allow me to, and very happy to be not only educating for them, but also treating the cases. So now, of course, I'm using Candid on most of the cases I'm treating. Yeah.
Yeah. So that's why I want to make sure that people understand that he left Invisalign. He chose a different route. And I want to make sure people understand that. That's a big deal. Okay. So, and that's why I wanted Ben on here, because from a doctor perspective, it changes the perception of how I think the product is looked at when someone of Ben's caliber, and everybody, when I mention Ben's name in the aligner space, everybody goes, "Oh, I love Ben, and Ben taught me." Well, Ben has made a change in the way he thinks and the way he's looking at the companies. So people need to pay attention now that Ben is talking about a different company. So I want to make sure that that's what we're talking about here. So I want to ask a question, and I think either of you can answer this, because I think it's important to also get it out of the way, and I think I mentioned part of it to you. I had a classmate of mine from high school reach out to me, asking me, should he do Smile Direct Club? And I was like, absolutely not. I've seen terrible results with that. He said, what would you recommend otherwise? And I tossed out Candid's name. There are a number of different options with Candid. Okay. I think you have Candid and CandidPro. So can you talk about the difference immediately? Because when doctors hear do it yourself, which that's not the only option here, their mind goes in different places. So let's get the elephant out of the room first. You have more than just do it yourself here. There's various options. So can you discuss that, and let's get this thing right off the bat out of the way?
Absolutely. I'd love to walk through the two differences. So there's two ways to get started with Candid. There's a telehealth only version of the product where a patient will come into one of our Candid studio locations, take a scan. So they'll have an intraoral scan, panoramic x-ray, and the full ABO array of photos, fill out an informed consent. All of the treatment planning is then done remotely by a licensed orthodontist in that state. And their case is then completed, submitted. The patient receives their aligners and they wear those aligners. And every 2 weeks, they're using our Candid app in partnership with some of the technology from a company called Dental Monitoring. And those orthos are getting scans every 2 weeks to review and make sure that patient is tracking. So there's very little do-it-yourself about that, because we do have the doctors heavily involved in that. But that's a lower cost option, right? So it's certainly, from a price point, it's lower, it's telehealth only. And I would say it's not limited in treatment, but it's a 16-stage max. And it's also, we try to really limit refinements and mid-course corrections and really keep the patient going there.
Is the reason for the low-cost option, is that strictly to compete against the Smile Direct Clubs that are out there? Is that the reason why that exists?
What we find is there's a price curve. And along that price curve, there are different patients who are interested at different price points. And we believe that from a marketing perspective, and as well as from a patient access and affordability standpoint, it's really important to increase access and create affordability for those who both can afford and prefer a version of the world that looks like that. But what I'll tell you is that for every 5 patients that visit my site, 4 of those 5 would rather start with a dentist in the practice. And that's why we launched CandidPro, because there is a strong desire from a patient perspective to have your clinician involved. And so on CandidPro, and I can turn it over to Dr. Miraglia to talk about the benefits of Pro, Our goal is to increase accessibility for the patient, so reduce the number of office visits, still with the monitoring technology, allow a doctor to provide a lower cost solution in their practice. So rather than selling it, $1,950 or $2,400, maybe $2,995 to $3,500, something in that realm. So you can dramatically increase case acceptance and case starts rather than selling at $5,000 or $6,000, because we're removing that chair time. So from a profitability standpoint, CandidPro can be much more profitable in your practice than any other clear aligner solution, because you're talking about starting the case with the first visit, maybe a 6-month hygiene visit and an end of treatment visit, and everything else monitored in the middle with remote monitoring. So it's truly beneficial to that patient, and patients are willing to pay an extra $500, $1,000, $1,500 to start with their dentist, because they understand there's more work involved, and that support their dentist is providing them is really giving them that peace of mind. So that's why we launched CandidPro originally, and we think it's just going to be a dynamite business for us, ultimately probably eclipsing anything that's in the direct-to-consumer space. And we're excited to add more and more doctors on every month.
So talk about, Ben, and Ben, you can handle this one. Talk about the advantages, disadvantages, why a dentist let's say they're an Invisalign provider. As the majority of us are, why do you want to become a CandidPro provider and provide this option to your patients?
Yeah, so I'll use my own story as an example over time, how it's like a natural progression to kind of evolve into Candid. Just using the least amount of IPR to no IPR over time, and then reducing attachments over time, it tends to make for a more comfortable and a simple treatment plan. If you have an expansive technique, which is what I have and what I teach, if you have a nice expansive technique and you're willing to take those cases and move all of the teeth to a beautiful position and develop a really nice occlusion, you're in that no IPR category. Once you're in that no IPR category and you're delivering very nice expansive technique with your clear aligners, you can start to realize the attachments aren't as necessary. And so over time, having gotten myself out of that IPR and reducing the attachments, it seems like the next step is, well, how do I just do this without attachments? But what it adds up to in the end is that you have an amount of chair time to treat a case. And then if you're in a very busy practice and you've got this chair time that could be with looking for clear aligner checks along the way, or in a different procedure that could be more productive, if you know the case is tracking well, you don't necessarily have to see the patient as often. So what we were doing in our office was giving out a number of aligners, but really without any type of monitoring. We might give out 5 or 6 aligners and then have the patient come back in 3 months, 4 months and check them. Now the idea is you have the Candid monitoring involved, which is, and just to make sure everybody understands what that is, the Candid aligners come with a lip retractor that they insert, which is easy to do, obviously. Then, of course, it's got a little magnetic box that attaches to it, and your iPhone slides right in. With the Candid app, they're able to do touch, touch, touch on a screen, and next thing you know, it scans them with and without their aligners in place. What the app does is, on a 2-week interval, with a scan, the software is sensitive enough to know, is that aligner perfectly fitting? In other words, you take a scan at the beginning, and then you take it at the end, your 2-week time period, and you get a response back that says, congratulations, move on to the next aligner. And if that aligner is not fitting perfectly, you'll get a response back that says, wear your aligner 4 more days, scan again, let's check it again. So now you have a full monitoring going on, even though the patient might be at home doing the monitoring. There's a site for the doctor to see it. So just the same way you have an aligner site, you've got your Candid site where you can look at your patients and you can see their chart and their treatment plan and their pathway. The other side of the site is the monitoring. So now you see where they got to go to move on along the way, or if they got to scan in 4 days, scan in 7 days, let's wear it a little longer. Now the software is pretty sensitive. It's very nice. The cameras on everybody's iPhone are brilliant. So you have this wonderful opportunity to go from aligner to aligner to aligner. And this is where the monitoring really makes the do-it-yourself an improper name. It's do-it-yourself if nobody's there looking at this. But with the monitoring, you have not only the treating doctor looking at it, but behind the scenes, you have the Candid team looking at the monitoring, because somebody has to take that and read it and then respond to the patient and say, you've got to go, move on to the next aligner. So it's really not a do-it-yourself. That's a misnomer for Candid or CandidPro. And with the dental monitoring taking over for me, I can give away almost the entire case and have that patient come back towards the end, unless they would like a visit, because we could deal with personal, patients. And every now and then you find someone that wants to come and visit you accordingly. That's fine. And then you can also do I see it, you got a no-go a couple times in a row. Why don't you come into the office so we could take a look? You can monitor in that fashion. The bonus with Candid is going to be you have a really nicely designed system that has a 4-year history of already treating about 60,000 patients. So as far as proving that you can move teeth, anybody who's using clear aligners knows you can move teeth really well with clear aligners. Clear aligners are the future of orthodontics. Clear aligners are going to replace braces. It's only a matter of time. And so same way composite replaced amalgam, clear aligners will replace braces. Now, what technique are you using? If you have a company that has no IPR involved, you automatically default to an expansive technique. You're not going to be treating crowding without IPR, without an expansive technique. In other words, you're committed to moving all of the teeth to resolve crowding. And so Candid is a company that's committed to moving all of the teeth. And that suits my personality and my philosophy very well, because from the beginning and any time I ever taught a clear aligner course, I was teaching about you're better off moving all of the teeth. Even if you only have a little crowding in the front teeth, if you move all of the teeth, you can avoid the IPR. If you move all of the teeth, you can develop a better occlusion, and your patient will have a more aesthetically appealing smile. You'll have better function, better stability, better comfort. You check all the boxes. So as far as Candid goes, no IPR isn't just as simple as, I don't have to polish. It goes beyond that into then the technique. Without the IPR, you've got an expansive technique. You're committed to moving all of the teeth. As far as I'm concerned, that's a superior technique. Then you add in no attachments. Well, you need a little bit to accommodate no attachment, which changes the shape and the style of the aligner. So now the aligner does engage the undercuts, the gingival embrasures around every single tooth. And the aligner does then cover about 1 millimeter or 2 of the gingiva. So it's a little bit more extensive of an aligner so that it goes a little beyond instead of just trimming to the CEJ. That will give you more control to be able to move the teeth without the attachments. So I have little concern about using a clear aligner system without attachments because I was already heading in that direction. I know full well what aligners are capable of doing. This technique fits those 2 items, and then you add in the monitoring. Now it fits in my opportunity to have less chair time, but a better monitoring process than if I just handed them to the patient and hoped they wore them well. So now I can monitor the case without chair time. Less chair time means more profitability in 2 directions. Number 1, the individual case I'm treating is more profitable if I see the patient less. But if I take all of those clear aligner patients and I remove them out of my chair is used for something else. So the profitability is in 2 directions. One is I'm spending less time treating that patient, more profitable case. The other is my chair is being used for something that's more profitable now, whether it be a crown or an implant or a bridge or the next clear aligner case to get started and move along. So it allows a higher volume of usage, and it allows more profitability for that chair to be used for something else. So you add it all up, and you've got a really nice, neat, clean system that covers all the bases. And in the end, it is really not a do-it-yourself because of the monitoring that's involved, and wonderfully capable. So for me, it was a really easy choice to make. I'm very excited about this opportunity.
So it sounds like, I just want to repeat a couple of the points that you just said. So you have a more affordable lab bill, okay? And what is a typical price that you see an office charge for CandidPro?
To the end patient?
Yeah.
Yeah, we see our average price point, again, some geographic differences, but somewhere between $29.95 and $39.95. So really that's kind of your range.
Okay, so you're seeing, in general cases, in most cases, you're seeing less expensive than Invisalign. Okay, so you're seeing a cheaper lab fee. And what's the fee to the dentist?
Our fee schedule obviously ranges depending on volume. So at our highest volumes, we're sub 1,000, fully included the monitoring, the box, the scan, the app, the support, all of that. And for the lower volumes, we're starting up at around 1,600, and we work our way down from there. And so we'll see most of our doctors pretty quickly in about that $1,200 range, all in for everything.
All right. So you're more affordable. You have a more affordable lab bill. Your treatment is cheaper than Invisalign. You've got reduced chair time because you're not worrying about IPR. You're not worrying about attachments on there, which obviously takes some chair time on there. You've got the monitoring software. You've got, we didn't mention this, but I'm assuming that because there's you're monitoring and there's no attachments, you are probably having less refinements too. I don't think anything was mentioned about refinements, but I'm assuming you have less refinements than you do with Invisalign then. So overall, it sounds like it's a much more appealing choice for dentists in that case.
That's the goal. The goal is to build the most appealing solution in the market, right? And as we get more and more practices on, we're driving really high levels of satisfaction. I think the biggest opportunity that, you have today in your practice is endo and ortho, and clear aligners are the future of everything in terms of ortho. And so we believe that, especially at the right price point and driving case acceptance, that you can go from 0 to 100 case starts a year pretty quickly if you adopt the solution.
That makes sense. So I'm going to ask this question to Ben, because Ben's the clinician. So Ben, people know the Invisalign name. Okay. So they come in and they see, and not that they don't know Smile Direct Club, and some may know Candid, obviously. I told Nick when we originally spoke to Nick prior to, right when we scheduled the podcast, I told Nick I was going to put a post in my Facebook group. Do you remember that, Nick? So I said, question for the group: have you heard of the company named Candid? If you have heard, let me know. So 26 people never heard of you. 22 said they heard of you, and 1 said they work with you. So just so you know the results there, okay? And then 1 person wrote, I see a ton of their ads on the street and social media. 1 person said, I have a close friend who did Candid. Another person said it's competition for Smile Direct Club. And they wrote another do-it-yourself aligner, obviously. And then there was a big comment. I'm not going to read the whole thing. And someone said, yes, my son worked for them. So I'm not sure about that one, but who that person is. But those were the comments that were left. So, obviously everybody knows Invisalign. Just when people think of whitening, they know about, Discus Dental or Zoom whitening, because they went direct to consumer. So when someone comes in asking for Invisalign, because that's what they asked for in a lot of cases, and this is more for dentists to learn, and I'm curious, how do you take the conversation to, well, we have another aligner company we're using, Candid, and this is why you should use Candid instead of Invisalign?
Yeah, and you could approach that in any number of ways, and you could combine it to all of these ways. But the thing there is, okay, now I've got these 2 choices, and the first would be, well, we meet the patient, we take a set of records. And then once I recognize that patient has a set of teeth and a malocclusion that I could handle with Candid, a clear aligner company without attachments, then I have, an interest in talking to them about their options. And so like anything else that we do in dentistry, we have options. And you could make the same analogy to who's missing a tooth. Oh, my patient's missing a tooth. I need to talk to them about an implant. I need to talk to them about a bridge. I need to talk to them about a flipper. I need to talk to them about a bonded bridge. So you have these different options. So now if I meet the patient that has a malocclusion that I can treat with an aligner company that doesn't include any IPR or attachments, has a dental monitoring built into it, and then on top of it has, and I have to add this in, which we haven't covered yet, but the app that the patient has access to has 24/7 coverage for them as far as questions and also service. So let's throw this one on the table just to put in the mix. When a patient loses their aligner, they can go to the app. There's a live chat. They can write, I lost my aligner. And guess what happens? A new one is made and sent to them. The doctor doesn't even have to know about it or get involved. So it takes a number of things right off the doctor's plate, because I would say that's one of the bigger troubleshooting things we have, is that the patient loses an aligner. What do we do about it? Candid handles that behind the scenes for you, takes that off your plate. So in the short story is that you're going to have patients come in. They're going to be a candidate for clear aligner orthodontics. And then which company is going to provide me my best solution for that patient, given their credentials? So if they have teeth and a malocclusion that I'm comfortable treating with Candid, which is going to end up being probably 85 to 90% of the cases that walk in will be in that category, then we can sit down and talk about the opportunity for the Candid monitoring during treatment. Then we can sit down and talk about the opportunity in the financial column. And the opportunity in the financial column is significant. And so if it's significant enough a difference, I have 2 ways to approach that. One is that I could enjoy the higher profit and keep it to myself and my team, or I could extend it to the patient. Now, here the lab cost is so different, it's appropriate for me to extend it to the patient. So I have 2 different things I can offer, and one of them has a price point that's here and the other has a price point that's here. So now we start talking the patient through it. And of course, when you're discussing with your patient, it's just really an informed consent conversation. So if I know I can treat and have the clinical outcome be amazing, and then I add in these extras, the bonuses of, well, I'm not going to be doing any IPR. I don't have to involve the patient in attachments at all. I have a clear aligner that's built not to do attachments with. Then I've got monitoring involved, and I've got a price point that I could probably make it, let's say, more affordable for a patient. I have more accessibility there. Next thing you know, I have an opportunity to have someone say, I would love to have Candid, even if they've never heard of it.
Gotcha. Okay. Again, I think that was important because I think it's a tough conversation for people who are so used to doing one way and it's an uncomfortable conversation when you pick up something else. That's why I wanted that,
Yeah,
that
oh,
out
absolutely.
of
And
the way. So
I can give my numbers just to give like a little bit of a feedback on, how it works, because a lot of people might walk in and say, oh, I see the Invisalign brochure. Oh, I see you're doing Invisalign, or I'm here for clear aligners. Do Invisalign. I've heard Invisalign. Okay. So I've started now 30 cases with Candid, and none of them walked in asking for Candid. They all wanted a clear aligner, but none of them walked in asking for Candid. So it's 30 for 30. I haven't had anybody that we sat down and we discussed this with say, no, I'll take Invisalign instead. So the idea is, if you have this opportunity to talk a patient through and you've had a good conversation, then they get to make a choice. But it's a smooth one. I don't find that to be difficult at all.
Gotcha. So someone's listening to this podcast. They said, okay, I have not heard of Candid before, but I'm intrigued now. What is the process that somebody does? They become a provider. Talk to me. A patient comes in, they want Candid. Talk to me about the process the practice goes through to get a patient through the process to get started.
So, Nick, do you want to just let them know how are we going to get a doctor that's interested in using Candid in their practice? How would we onboard them?
Yeah. So if you're interested, the first thing to say is if you feel free to email me. I'm the CEO. I'm Nick, Nick, at candidco.com. And I will make sure we get the right people in front of you to help you get started. And then in terms of the process, once you've signed up, we have a 2-stage process. So the first thing to do is we have what we call an implementation team. And the implementation team will come in and provide a full training for you and your staff, really the assistants and the hygienists being that face and having those initial conversations. And then, of course, walking you through the clinical. And we will commit at Candid today to doing either a 1 or 2 day implementation and training where we come in and we'll really show you the whole system. That's how to take the intraoral scan, or if you're sending impressions in, where to send those impressions. It's how to take the ABO array of 8 photos to make sure we get the full clinical diagnostic photographic records at the beginning of treatment. From there, it's if you have a panoramic X-ray, how to submit that X-ray, or if you have another X-ray, how to submit that X-ray. From there, we have our own software. So you'll take a scan. We're compatible with any scanner, fully open system. You upload the STL file, you upload the X-ray, you upload all those photos, you get that, the consent from the patient, and then you get those kind of key medical things that we may need about prescriptions, anything of that nature, really, really straightforward. You hit submit. 5 days later, you'll have a treatment plan that's been produced in Costa Rica, reviewed by a professional orthodontist licensed in the United States, who will actually sit in between that case and review it and make sure that we feel like it's a high quality case that's going to you. So you don't have to do a ton of back and forth, especially if you haven't done a ton of ortho. I think that's a huge benefit. At that point, you can accept the case. We manufacture that in about a week, and we'll either send it to your practice or send it directly to the patient based on your instructions. So it's a really simple process. You can go from scanning a patient and submitting a case to having that patient in aligners in well less than 4 weeks.
So you accept aligners or scans from any scanner. So iTero, Medit, any of those scanners, it's an open source file and they just send it off to you.
Yep. So you download those scans and then upload the 2 STL files in there, and then we can accept those directly.
Gotcha. Okay. All right. I'm curious, do you like scans better from any particular scanner? I mean, just personal preference?
We find that most of the scans, across the board work. We prefer intraoral scans, but we do have a program to take impressions. But we do find that the scans just really simplify and expedite the progress. And I think, as we continue to grow, we're going to have more and more options for doctors who are interested in getting a scanner and want to be part of the CandidPro community to get access to scanners, hopefully in a lower cost.
So a doctor decides to come on. Do you provide any marketing for the doctors to promote this new clear aligners in their practice?
So we have a considerable amount of marketing material. We'll provide a doctor a whole package to get started, signage, information, all of the kind of key talking points. And really that implementation and immersion program is so exciting because we're taking people who have come actually from our retail stores who deeply understand how to talk to that patient and how to have that critical conversation with the patient. And they're helping train you and your staff on how to sell clear aligners in a way that maybe you don't know how to do. So Dr. Miraglia, who's been doing this for 15 plus years, but a lot of folks who are really getting started or don't sell that many cases, maybe 1 or 2 a month, we want to help you get to 5, 10, 15 and come in and make that happen. So we provide those materials, we provide the training, and then we have additional resources. For example, Simone Biles is our celebrity spokesperson. So we have, materials with Simone in them, and we can help you find cases and send emails out to patients to get them into your practice to show them the benefits of clear aligners and working with CandidPro.
And then do you have any direct relationship with any financing companies if patients need financing, or that's on the practice to do on their own?
Today, through CandidPro, we are working on building some of those financing partners out. We don't want to add that additional complexity. We do see that most practices will have a care credit or some type of lending club, some type of patient financing system. We actually originally put it into our system. So we have a partnership with Affirm, which is a
buy now, pay later.
Yeah, buy now, pay later company. And we found that doctors were finding it kind of more challenging to use our system for that. So we've established that the doctors are doing that on their own, but in the future, it's something we'll continue to work into our system.
Gotcha. I know that's a question I get a lot because I teach a financing class, a workshop on financing, and that's a question I get a lot. Invisalign's partnered with Lending Point, and they can pay their bills through that. And it becomes a common question I get as to what to do about those things. So that's why I was asking about the financing part of it.
Monthly financing is really valuable for patients. It really
it is. It makes the money conversation very easy if somebody knows they can pay for it. And we become that type of society. That's why the firm and all these other type of products have become so popular, because you hit a button and you pay it off over 4 or 5 payments rather than having to pay now. That's just the society we live in. Is there anything else that you think is important that either Nick or Ben or both of you, that you think is important that we kind of get out to the audience to know, why they should email Nick and find out more about the product or want to become a provider? Because again, like I said, many are there. You've got ClearCorrect, you've got Invisalign. Those are the 2 bigger ones in the market. But now you have another option that the dentist can do in the office, and eliminates a lot of the concerns that, dentists have with doing these things is chair time and everything else. So refinements, et cetera. So is there anything else that you want to make sure that the listeners and viewers know?
Look, I would say from my perspective, we're really excited to really begin a deeper partnership with the dental community. And we know that as a perception, coming in as a company that started in the direct to consumer space and still has a business there, that's a key question. And we really want to have that conversation with anyone who's interested in partnering in CandidPro. And we can commit that if you commit to CandidPro as a doctor, we can dramatically change the revenue profile of your clear aligner practice by driving way more case acceptance. And I think that that's really the key here, is you're going to have a much more profitable per chair hour clear aligner system than anything you've used in the past. And we want to make that happen for you. So that's for me, the biggest takeaway. And then the last little thing that I'll throw in there is when Dr. Miraglia and I met, we spent about 30 minutes talking clear aligners, and we spent about an hour and a half talking airway. And I'm super excited about all the opportunities that clear aligners is one of the most exciting new opportunities in dental, and the integration of airway, of all the things we can do on that front. And so, Dr. Miraglia, maybe if you want to close it out there and just kind of what you're thinking and how we can use clear aligners to further that in the future.
Oh yeah, definitely. So certainly the next step in the whole entire clear aligner evolution is to be able to do it without any attachments. And so right now you have Candid as that leader. So they have 4 years of case treatment already behind them to show that not only is it possible, you can be very effective and solve a malocclusion without attachments. So the opportunity to take any aligner case and instead of using 6, 8, or 10 or 12 attachments and have no attachments with just a clean, clear aligner on those teeth, it's a next level of comfort for your patient. It's the next level of smooth and easy. It's the next level of no chair time. It's the next level of ease on the team, especially if some of your team are doing the attachments and removing them. So you have a wonderful opportunity to, experience this for yourself. I would say it's worth the effort to get signed up and try a few mild cases just to prove it to yourself and see, hey, look what this can do. And then talk to your patients about how they feel wearing them. What does it feel like? Put it on yourself. Try it out for yourself and see how that feels. I think you're going to find that this is where the entire clear aligner market will probably follow once Candid, establishes that we're going to treat the majority of our cases without attachments. And here goes, and here it is. So I'm looking forward. I'm excited about the opportunity, and I can't wait to, work with and partner with other companies and people that are involved in this direction. And like Nick was saying, as far as airway goes, while it's an early stage, the opportunity to have a non-IPR fully expansive technique opens up more space for the tongue. And so as soon as the tongue has more space, you have an opportunity to improve someone's, breathing, sleeping, etc. So over time, as that puzzle gets built, Candid will probably have a position somewhere where research could be involved, as well as demonstrating that not only can we say it, we can actually prove it. And so that's a real incredible opportunity, because that's the hottest thing in dentistry is airway and sleeping and breathing. Well, tongue space and growing more tongue space comes from moving the teeth away from the tongue, and this is that technique.
Yeah, it's funny when you mentioned in the very beginning that there's no IPR and it's fully expansive movements, and I knew you were very involved in the airway. I said, there's a definite connection there, and I was waiting for it to come up. If Nick didn't ask you about it, that's what I was going to ask you next. So I appreciate you bringing that up, Nick, because that's where I was going next, because I knew there was a connection there. So, because that made total sense to me, and I know how passionate Ben is about airway. So I know that you wanted to toss an offer out to the listeners if they want to become a provider. So Nick, do you want to let the listeners and viewers know what offer you have for them?
Absolutely. So for all of the Raving Patients podcast listeners here, we have a really special offer today. Email me, Nick, N-I-C-K, at CandidPro.com. I'll put you in touch with the right people. For any provider that would like to commit to an implementation and immersion on us, no cost. It's about $5,000 in value. We will include with that also a free case to get started after that implementation. So we want to come in there. We want to help figure you out how you can build a big clear aligner practice. And we're going to give you that first case to get started. So email me again, Nick at CandidPro.com. And hopefully we can get a lot of people going here, and you can see what Dr. Miraglia and many other dentists around the country are using with CandidPro.
Gotcha. And Ben, if people want to reach out to you, what's the best way for them to reach out to you?
The best way to reach out to me would be through Candid, because this way, if they can get connected to Nick first, that'd be great. But I am certainly there and willing to answer more questions. And I think, Nick, redirect anybody that has a direct interest in talking to me. I'm happy to take a call, and we would be happy to talk to anybody about questions they might have, or just if they wanted to chat personally on a one-to-one basis. Send Nick that first email, and then he knows how to connect you to me. And I would be happy to talk to anybody and help them in this journey.
Well, guys, if we piqued your interest, please reach out to Nick. It's Nick at CandidPro.com. Send an email, tell him you heard about us or heard about him on this podcast. Let him know you want to learn more about how to become a Candid provider, and he will get you hooked up with the right people. He'll then give you access to his great product, I should say. It's not new, 2017. So I misspoke there. I apologize. If you liked the episode, please share it. Please like us. Please review us. The episodes come out, remember, Fridays at 1 p.m. The new episodes drop every week. We're entering into season 5. So we've got 4 seasons to catch up on if you are just joining us. And we didn't talk about reviews, but you know how important reviews are for your practice. And always remember, your reputation matters. Until the next episode, Nick, Ben, this was awesome. Thanks for joining me, and we'll talk to you guys soon. Again, thanks for listening, guys. Have a great day.
Thank you.
Thank you.